Welcome to the Functional and Integrative Medicine podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other MDs and DOs to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with MDs and DOs since 2012. My passion for root cause medicine and physician advocacy drives me to help MDs and DOs who have incorporated functional and integrative medicine into their practices. So let's dive in. Hey, everybody, welcome to the podcast. Today, I'm thrilled to announce Dr. Aimee Duffy, a renowned expert in wellness and functional medicine and a visionary founder of Carolina Integrative Medicine. With over 20 years of medical experience, Dr. Duffy has dedicated her career to helping patients achieve optimal health through personalized care, advanced diagnostics, and cutting-edge treatment strategies. Board certified in family practice since 2006, Dr. Duffy brings a wealth of expertise in obstetrics, gynecology, and addressing complex conditions such as hormone imbalances, thyroid issues, and adrenal fatigue. Her holistic approach focuses on empowering patients through nutrition, hormone balance, stress management, fitness, and longevity, enabling them to maximize vitality and improve their quality of life. Beyond her practice, Dr. Duffy is a passionate mentor, leader, inspiring patients and professionals alike to take control of their health and embracing a lifestyle of wellness. I'm excited to dive into her journey, her unique approach to integrative medicine, and her vision for a healthier future. Let's give a warm welcome to Dr. Aimee Duffy.
Hey, thank you so much, Ginger.
Thanks for taking the time out of your busy clinic to meet with us today.
Absolutely.
And we're going to go ahead and dive right in. So if you could just kind of tell us a little bit about your professional background and what led you to the world of functional or integrative medicine.
Yeah, it's interesting. It kind of comes full circle. When I was a little girl, I just absolutely loved babies. I just wanted to hold all the babies, and any chance I could get to hold a baby, I was volunteering in the nursery at church with my dad, and we were at a pancake breakfast, and there was a family there with about an 8-month-old baby who was sitting in the sand kind of playing. So I started, chit-chatting with him and playing, and the mom was like, "You should come babysit. He loves you." And I said, "I don't know if I'm old enough to babysit, but I would love to come play with him." And so at 11, that was my first job. I went and just was like mother's helper. I just went over and played with the baby, which I thought was the coolest thing ever. And then they paid me to hang out while she just got stuff done around the house, right? And that relationship with that family, and then her sister who also had babies, sort of continued all the way through college. Like I'd go home in the summers from college and still babysit for them when I was home. So when I was 17, a senior in high school, they invited me into the delivery room when baby number 2 was coming. And that was like my first experience in that kind of setting of a delivery room, of a medical procedure, that sort of stuff. And I was just in awe. I mean, when baby Joshua was born, put on mom's chest, I was just like, this is the coolest thing ever. I want to do this. I want to deliver babies. So that's really what my passion was to going into college and medical school, was I was going to deliver babies. And I thought maybe I was going to be a midwife. So part of that tangle was growing up in Colorado, and I call it, I grew up granola world, like, very holistic approach. My mom took 3,000 vitamins. I didn't know what they were. One was her broccoli pill and whatever. But very, granola, like I call it, a approach to health and wellness and all that kind of stuff. So I thought maybe I would just be a midwife because, doctors gave people medicine, and I knew I didn't want to do that. And so over time, what happened is I ended up doing family practice because we could deliver babies too, but then we could also take care of the babies. And I had a baby in medical school. I had a baby in residency. I've had 4 babies of my own. So, I knew that I wanted a lifestyle that allowed me to still, raise my own family. So family practice seemed the right place to be. Well, after I finished residency and I stayed on as an attending physician, I was invited or offered a job at an OBGYN office here locally in our small town in South Carolina. And I thought that was a perfect blend. I could deliver lots of babies and then be primary care to the moms. And that's kind of what they needed, because a lot of women go to their GYN for their primary care as well. So that was fantastic, except I didn't really learn very much about hormone stuff. And so all of a sudden, on the days that I wasn't delivering babies, I was, I had a schedule full of GYN stuff and women's health and more than just annual exams, but it was, hormone related questions and things. And I thought I didn't have enough training in this. So I kind of started doing my own research and learning more about hormone replacement. And that was also right after the big issue with the Women's Health Organization or the Women's Health Initiative that ended the study that they were doing on Premarin and Prempro about hormone replacement in late 90s, right at the early 2000s. That study came out and was actually stopped early because what they found is that women that were on Prempro particularly had a significant increased risk of all these bad things like strokes and blood clots and heart attacks and breast cancer. And so all of a sudden we were all told hormones bad, we should stop using all these hormones. So I'm right in the middle of sort of learning about hormones and now realizing, are hormones good or hormones bad? And really the statement that just came out was like, use the lowest dose possible for the smallest, the shortest period of time to manage the symptoms. But it was like, we were handing out birth control pills for women that weren't menopausal yet, but having menopause symptoms. And then, trying to decide, should this patient be on hormones or not on hormones? And then we were advised to use antidepressant medications to deal with the hot flashes instead of, hormones, because hormones were not safe. And I just was like, I don't know what to do with this. And it was very frustrating for me and patients. And I knew that there just had to be another way. Like I just needed to, educate myself a little more. So I happened upon in 2008, a conference on natural hormone balancing and natural weight loss solutions. That was the first time I had really ever experienced anything like that. And so here I was at this conference learning about saliva testing and bioidentical hormones and adrenals and digging deeper in thyroid. And I was like, it was like Alice in Wonderland going through that tiny little door into this world of what we call now functional integrative medicine. And that was my first exposure to it at this, 2-day conference in San Diego. So of course I come home and I'm like saliva testing everybody that I know and just, working. My mom was my patient at that point. I'm like, hey, everybody, I need to take a saliva test so I can learn about this. So, and I tell people that are learning all the time, I probably called the lab to help me understand this, with every single patient for the first 6 to 9 months of learning this. Like I didn't know what I was doing, but I knew that I liked the idea of it. So, I did a test. I would call and say, hey, help me understand what to do with this patient, whatnot. So, you start to see patterns and you start to develop this. Well, long story short, 5 years later, that practice was going to be bought out by the hospital system. I was now doing my woohoo stuff and didn't want to go into the hospital system. So I opened Carolina Integrative Medicine in 2011. So going on 14 years now. And, a roller coaster ride from the business perspective. We had COVID, we had all the things, but, we made it through all that stuff. And now, we just have a great practice of really getting to the root cause of things for patients, and hormones is a big part of that. I mean, that's what led me to even being able to consider opening my own practice, but really connecting with the things that you talked about in the intro. Like we can't help people with their hormones if we're not addressing their nutrition and their gut health and their mindset and moving and all the things that we're trying to do. So, getting rid of those band-aids and really saying, hey, what are the things that we really need to pay attention to? And it's often multifactorial, but hormones are a huge part of it.
Wow. So 2011. So you've been doing this for a long time. You were one of the trailblazers that were like, I don't care what people say. I'm doing this.
Yep. I'd run into colleagues in the hospital. How's your voodoo medicine going? Just as a joke. I mean, I
loved how you call it woohoo.
Yeah. You're going to do me a woohoo over here. So, and it's really not. I mean, everybody still thinks it's woohoo medicine, but I mean, we have so much evidence-based. I met you at a conference, right? Like we're at CMEs all the time with, I mean, it's so exciting to be at a conference like that where there's thousands of medical providers who are listening and learning about what we're up there speaking about, right? And the fact that there's been doctors, longer than me up there speaking about it. I'm still learning stuff all the time as well. So, it's really growing in the conversations, but it's still, we've got so far to come. I mean, I just had a patient yesterday who told me her doctor told her she could never be on hormones after she had surgery for a fibroid. Like it's not even it wasn't even cancer, and cancer doesn't cause, hormones don't cause cancer, and
Not
we
the
can
kind you
fight
use.
that battle, right? But like, oh, not even that. So it's
Yeah.
still
Well,
just
again, he's referring
out
or
there in
she's
the world.
referring to Premarin, right? So they're just not educated on these
Yeah.
different types of hormones, the natural
And I
stuff.
don't know that anybody's even prescribing Premarin or Prempro anymore. I
Oh,
have
yes, they are.
time.
Okay. Yeah, my mom's 84 years old and they just got her off of it after 50 years because the doctor was like, you really don't need to be
Maybe
taking
we
this,
should do this.
Gigi. But she was on it for 50 years and she loved it and she did not want to let it go. And she take her Premarin for her, she was going to kill somebody.
Yeah.
So I get it. And yeah, so it is interesting, that you bring that up, that they still think it's woohoo. I think the way I like to explain it is, it's really just getting to the root cause, right? It's looking at the nutrition, it's looking at the supplements, it's looking at the actual, not just basic labs, but the bigger,
Right.
lab panels. And I remember my husband, I don't normally talk about my stuff, but I'll share it here because I think it's appropriate. My husband's a radiologist, and when we met, he was having a lot of gastrointestinal issues. And I said to him, maybe we should look into organic foods. What do you think of that? And he's like, I don't know. They didn't teach us anything about nutrition in med school.
Yeah.
And I was like, okay. I said, well, what is it going to hurt? We'll try it. And so we switched to an all organic diet and it immediately eliminated all of his GI issues that he was having. And I was just amazed by that, just the food. So yeah, there's a
I
lot
see that
of,
all the time.
you
Yeah.
know,
And
there,
that's not woohoo. I mean, it's just, to me, a lot of this
common
is just
sense.
common sense, right? It's like, let's stop putting things into our body that our body has to go, what are you and what do I need to do? I mean, our body's job is to protect us, and it's so busy protecting us in this world right now. Like it gets distracted. Like it's so busy protecting us that it can't do its normal thing. So when people say, why don't I feel normal anymore? Well, it's over here trying to fight the fight every day with what we're putting into our system or what we're
Correct.
being exposed to. And, one of my favorite things to talk about is adrenal dysfunction, because where our adrenals were made to, wake us up in the morning and help us go to sleep at night when the cortisol goes down. And then on occasion, if we were getting chased by a saber-toothed tiger, we would run really fast and jump really high and not feel our ankle pain if we sprained our ankle or something, right? Like that's what normal is supposed to be. Yet we live in this world where it's like we have little tigers chasing us all the time. We've got traffic to be in, we've got the clock, we've got alarm clocks we're waking up to, we're going to boot camp at 4:30 in the morning, whatever the case is. That's just adding more and more stimulation. It doesn't necessarily have to be negative stress, but the more we are stimulating our brains to be in that kind of fight or flight mode all the time, it's just draining our systems. And people
Your
don't realize,
your cortisol
yeah,
levels are constantly on fight or flight.
they're high all the
And
time.
so,
Yeah.
right.
And then what happens by the time they get to me is their cortisol's tanked, right? They have actually adrenal fatigue
Oh,
or low cortisol. So most of the time what I'm measuring is low because they've already hit that. Like when cortisol's
oh,
high, we're like, woo, we can keep going, right? Like that's what happens when you're getting
I
chased by this
didn't
tiger,
realize
your
that.
cortisol's
Okay.
high. It's not going to tell you you should stop and take a nap or go to the bathroom, or you have pain here, you should stop because we have pain. Your body's in survival mode. It's got to keep going. And so
Okay.
when cortisol's high, we don't stop. We keep going. Like we can push through this. That's why we joke around, we have babies in our 20s so that we can keep going and not get worn out. Or when we're in college, we can have those nights where we can have no sleep at all to stay up late and study and bounce back in no time at all. And now, we talk about staying up past 10 p.m., right? That's
Oh
not
my
good.
gosh.
That's just our adrenals can't do that anymore. So by the
Got
time
it. So
somebody
it's
gets to me, generally speaking, their cortisol is tanked, it's low.
got it. So you just like burn out your
Yeah,
cortisol
yeah,
and then you have this thing called adrenal fatigue. I just learned something. I learn something every time I do an interview. I just love this stuff. It's so cool.
and it
All right.
starts
So
to
moving.
relate to all the things. So, I mean, I can just go on and on about adrenal stuff, but that's our core issue. Our body's job is to help us stay alive, basically, and
Sure.
and so it has to have cortisol to do that. And cortisol is an anti-inflammatory. So now we're leading to all this inflammation in our system because our cortisol's tanked. Our natural immune system is not working. So we see people get more and more sick. We're not sleeping well. We're in this like tired and wired, sort of your brain doesn't know, am I supposed to sleep or am I supposed to be awake? So we're exhausted all day, but then at nighttime we're wide awake and not sleeping. So, and that's when we're supposed to rest, digest, and recover. So then we got GI symptoms going on, which can be stress related for sure. And then you put on top of that the food that we're eating that has all these chemicals in it, and that's just another stressor. So then our hormones start to get messed up because our cortisol is trying to lead the way basically, and it's not working. So
just one thing leads to another. But can you share a story? And I know you have thousands of patients, but can you share a story about a patient whose life was significantly improved using a functional integrative approach? Somebody that comes to mind that really stands out.
There's so many, but I'll tell you about Penny because she just, I tear up even when I think about her. And anytime I have a new staff member come in who maybe hasn't heard her story yet, I said, this is why we do what we do. And, you might talk about being on TV and podcasts and, all social media stuff as marketing. But to me, it's like, if people don't know that you're there, then you can't help them. And so all the stuff that I'm doing is all about just making sure people are aware. And whether, you hear this podcast where you can come see me, excellent. But if you can't, I can't see patients all over the country. I'm not licensed all over the country, right? But if you read this and it inspires you, or you hear this story and you go, oh, what's functional? What's integrative medicine? I have hormone issues, or I have fatigue, and you seek a doctor that is speaking this kind of language and you can get help, then, that helps me know that I've touched lives. Right. So Penny literally lived within walking distance of our office, and she was diagnosed with myasthenia gravis a few years before that, which is a pretty severe autoimmune disease. And it basically tanks your muscles. Your musculature doesn't work anymore, the signal from your brain to your muscles, and then your muscles atrophy. So she was really struggling. I have a picture before and after where one of her eyes was just completely closed. She said she could hardly hold her head up to brush her teeth. She was a Clemson professor, and so very academic, wanting to read all the time. And she couldn't read. She couldn't even be on her computer really. And she was just declining rapidly and on multiple medications, including, high dose prednisone and some other things, and seeing neurology and cardiology and all these people. And she ended up having a heart attack in her home, but it wasn't the classical kind of chest pain. It was more like her muscles just gave out, and there just wasn't enough oxygen going to her system. But when she gets to the hospital, she's treated, like a typical cardiac patient. So she's put on statins and blood thinners and all these things, realizing it wasn't a clotting issue or a plaque issue. It was more a musculoskeletal issue. So she just was getting, everything was sort of separated, and she was really terrified of what the next step was. And she'd go to her neurologist, and basically the conversations were what to expect as this gets worse, instead of how can we help you get better? And I understand where they're coming from. If they have something that they feel like is incurable, then they're not going to be able to take care of it. So how can we help you? So she ended up hiring a nurse to come every day, just literally to make sure somebody was there in case, she didn't wake up or she couldn't get up or something like that.
Oh
so
gosh.
She happened to be, barely making it out to her driveway mailbox, and her neighbor drove by and was just checking on her. And somehow the conversation came up, and the neighbor said, well, have you gone to Dr. Duffy? And she said, well, I don't know who that is. And so she found us. She was literally in our office, the next Monday, whatever that was. This is her story, I was in your office next Monday, understanding everything that you're doing. So we did our deep dive. We looked at what was going on with her gut, what's stressing her system out, what deficiencies might she have. I didn't touch any of her current medications, but as she worked through us, and in our practice, we have a lot of videos people watch, and, connections. She couldn't watch any videos. She almost quit because she said, I can't do this. And I said, well, you just come into the office, a few minutes early for your appointments every week, and we'll watch them with you, or have somebody play them for you, so you don't have to do it yourself at home. So we really find that individualized approach to help that patient. But 6 months later, she is bright-eyed, she's moving, she's walking with her dog in the botanical gardens. We're now 4 years out from that experience. She said, you saved my life. She was going down, and, she could walk to her office. That's what I'm saying. She was that close. She was local. It's not like she had to go find us, from some other faraway place. And that just breaks my heart, that if there's somebody out there that didn't know that we could help them, and they're suffering like that. So, I want to get the word out that there's a different way. that we've got to look at it from multiple perspectives. And, she was in her late 60s at that time. So of course she's menopausal and, but hormones probably wasn't driving factor for her, although it might've made things worse as she went through menopause for sure. But, really had to dig to that root cause for her. And, with autoimmune disease, we know that, most of the root cause is in the gut and the stressors that are going on there. So once we started really tackling that, helping her to understand, we do food sensitivity testing. So, what foods were causing stress on our system there, getting her some immunoglobulins and things that are going to help boost her immune system. She went from, 6 or 8 medications to only being on her thyroid medicine and her hormone cream, basically. So
Oh,
no
that's
longer
such
on
a success
medication.
story.
She's
I
no
love
longer,
that.
yeah. So her grandson at the time was born over in Thailand. Her son and daughter-in-law were on, working in Thailand out of the country, and she'd never met him because she wasn't strong enough to fly over there and visit. So now she's got 2 grandbabies. They live in Virginia, so they're coming to visit her all the time. She's driving up there all the time. So,
That's
life-changing
wonderful.
experience for her.
I love that.
And that's just one of
So
many stories for sure.
that's awesome. And the podcast is really tailored to other MDs and DOs, and I want them to hear these stories because, you know, it's not it's not that they don't want to help patients, it's that they weren't trained on a lot of these modalities, right? And they were trained to treat symptoms, right? They weren't really trained to go into the preventative and looking at all of this stuff. So these kind of stories really share the importance of the type of medicine that you do.
Absolutely.
So I'm sure, adding this approach brought challenges, to running a medical practice. What did you run into and, how did you navigate those?
I think probably I would say the most frustrating one is just how we get paid. Because, we dive into the insurance because that's the first question is like, "Oh my gosh, this is amazing. Do you take Blue Cross Blue Shield? Does your insurance cover it?" Right?
Right.
And I think that's probably a driving factor for a lot of practitioners when they're out there, if they are, you know, in the system basically. And I would say the majority of practitioners out there are probably employed at this point by some bigger medical system as opposed to owning your own practice. Um, the system is broken. It doesn't allow us enough time to really spend with our patients. It does keep you in that sick mode and that, what prescription can we get you on, the next step, that sort of thing. And so we've got to take a step back and really say, okay, what are we doing for our patients? And so I think that's where the biggest frustration comes from for practitioners is to realize that if we really want to help our patients, we've got to get out of that sick model and that sick system and look at how we can help them in a different way. So
Right.
insurance doesn't cover it. It's not that I don't accept insurance. It's that, I tried for years to get insurance to cover these things. And, we'd get headaches and the patients would get headaches trying to chase insurance to pay for whatever testing that we were doing, still trying to bill, insurance for the office visits that would always be 45 minutes to an hour, but we really couldn't bill for that longer period of time. And it was just kind of a mess. So,
So you're
really just
just on a
taking,
straight cash pay basis now?
I am now, yeah.
Yeah.
And really incorporating it together into the whole person. So we do a program approach so that we can have coaching involved, we can have supplements involved, we can have additional testing if we need it. So
Sure.
the patients really know up front what they're getting into and not just, even the fee for service. It's like, well, I feel better, so I don't need to come in for a follow-up, right? But we know over time compliance will go down with that. So, you
Yeah.
know,
Yeah.
the
A lot of
insurance frustration is probably the biggest hurdle, I would say that you really have to overcome. And I think once patients get on that path, hopefully they hear some of these stories and they recognize the importance of investing in our health. And it's not insurance premiums that we're investing in, right?
Yes, and I have a friend of mine. She has a functional gynecology practice, and she bills insurance, but she just does the traditional office visit. But then she does it over 4 visits, right, to try to help patients because she really wants to help patients. And yes, she's making less money, but she does it because so there you can transition on the insurance model to cash pay, and she does have people that do cash pay, but I always tell patients when they say, "Well, I don't want to pay cash," I say, "Well, what is your deductible per year?" And they're
Yeah.
like, "Well, it's like $4,000." I'm like,
You're paying it anyway.
You just, you don't see that you're actually paying cash because you
Right.
just, you're paying it in little increments here and there, but you are paying it
And when you're
over
able to,
time.
I mean, really from that perspective, it's better to have a lower premium with a higher deductible and, you know,
Absolutely.
just
Exactly.
use the insurance what it's there for. When you have a serious illness, you have, an accident that requires surgery or something like that. I mean, we do have the best healthcare system in the world when it comes to that kind of stuff with,
Sure.
surgeons and top-notch care from that perspective. But just taking care of kind of the chronic disease preventative stuff is just, it's not a good system. So we have to take
Agreed.
that step out and say, insurance is not recognizing the things that we do. Again, we call it woohoo medicine. They call it, oh, that's experimental and it's not been studied. Well, it has been studied. I mean, we're over here left and right showing the evidence of the studies that are out there for hormone replacement, yet insurance for hormone replacement is still stuck in that use the lowest dose possible for the shortest period of time. So we get somebody that's, in their late 50s, insurance is not covering.
I always say it's an archaic system that hasn't, caught up with the times. And
Yeah.
when insurance companies learn how much they're saving by working with functional and integrative medicine doctors on preventative
Huge.
care,
Yeah.
oh,
It was huge.
the millions of dollars that they would
And
save
I've
in
seen it over
cancer
the
and,
years. I've seen
oh,
multiple little areas where we're trying to move that, the evolution of functional medicine into,
yes.
some sort of group system of coverage, that sort of stuff. I know people have tried. And we'll get
Well,
there one day, I hope.
insurance just, yeah, they just have to see it's all about the money to them,
Oh, yeah.
right? Until they see
Won't
how much
even.
money that they're going to save, they're not going to believe it. But it's stories like Penny that, hello, talk about all the medication she was on, talk about she was headed towards probably needing full-time care, and she
Yeah.
probably would have gotten, another disease on top of it. And you prevented all that. And now she's in her
Right.
she's probably
She's in her
70s,
prime
80s now, and she's fully functioning.
spending
She
no
doesn't take
Medicare dollars,
medication.
you
That's what
know?
I'm saying. She's spending no Medicare dollars. So they'll
Yeah.
figure it out, but it's, it's going to take time.
Or they won't.
So
I mean, I hear the
I,
frustration with traditional doctors like orthopedics who are getting paid less and less and less for these all-day surgeries,
yeah,
in joint replacement and stuff like that. So, I mean, it's a bad system in terms of even the reimbursement. If we did take insurance, they just keep paying less and less. So all the money's going to the insurance companies and not to the providers for sure.
yes, we know. That's why I always say we need to support our med packs. So what advice would you give to other MDs and DOs that are thinking about adopting this approach to medicine?
Um, I really think it's just coming at it with an open eyes, and I think most people do, have this gut feeling that I don't know all the answers, and I think that's the biggest thing is like I didn't know anything when I first started doing this, but I was passionate enough and driven enough to say I want to know more about it. And I think these days, again, there are plenty of outlets out there for learning. There's A4M, there's IFM, there's SFAM, there's conferences left and right. I can tell you because I've been traveling and speaking at all these conferences. So, the evidence is there, the training is there. Take a big deep breath, and it's got to be a leap, right? It's got to be. I mean, you can take some baby steps, but to get out of your rut in that traditional stress filled, you're seeing patients all day and you got to go home and chart for 3 hours at nighttime. That's no way to live your own life. And so you got to do this for you as well as doing it for your patients so that you're not going to be burned out.
I
We're all
love,
headed towards fatigue and burnout. We all have adrenal fatigue. If you went to med school, man, your cortisol's tanked at this point. So you got to
I
take care of
love,
you, and
yeah,
you
I
owe
love
it
that
to
you
those
share
you
that.
love to be in the best position that you can be so that you can help the patients and your family and all the people that you love to be in their best place. So take the leap.
I'm so glad you shared that because I will tell you that all of the functional and integrative medicine MDs and DOs that I've interviewed are so happy. They
Yeah.
love what they do. They are not stressed out. They are just joyful, they're just having a great time. And I think, almost all, I would say majority of doctors went to med school because they really want to help people.
Yeah.
And so now that you're able to really do that at a root cause level, it just brings so much joy. And so that's a kind of a
Absolutely.
overarching thing that I'm seeing is that, if I interview a traditional MD, they're like, oh my God, I'm seeing 50 patients a day. I'm burnt out. I feel like I can't help people. I stay up at night. I'm doing charts at home. I'm trying to, figure out how I can help patients. The insurance companies are not paying me to really go deep dive. And so and that is affecting their health.
Absolutely. It's affecting their health, their family,
Oh, yeah.
Divorces, kids with, their own mental health problems, whatever. I'm sure their diets are horrible. They're probably drinking a lot of wine. They're drinking a lot of coffee, like all kinds of stuff. I mean, it's just a very vicious cycle to be in. And you can't really be present for those 50 patients, right? You're just going through the motions. You're checking some boxes and even
that's
though
not what people signed up for.
Your heart was there, right? You were there because you wanted to help people, but now you're stuck in this system that's not letting you really do anything.
And it doesn't value you as a physician. That's right.
I rarely, yesterday I had a busy day and I saw 6 patients. Like that was a long day for me, but my patients are hour-long visits. So I had a 9 o'clock, 10 o'clock, 11 o'clock. I had a lunch break. I had 1, 2, 3, got some charting done before I walked out the door right at 5 o'clock to hit the gym. That's a perfect day for me.
Great.
And
I love to hear that. And that's a busy day. I love to hear that.
No more than 50 patients. Been there, done that in the OB world. I mean, we just load them up. So it was crazy.
Yep. All right. Last 2 questions. What trends in functional and integrative medicine are you most excited about? I know there's, a lot of stuff going on with red light therapy and mitochondrial health and all this fun stuff. Like because you've been doing it for so long, what would you say like right now in 2025 is kind of like, you know what, this is kind of cool. I'm going to like check this out. I'm gonna do some more studying on this.
I don't even know if it's new, but it's like where you see the trend. So peptides are huge, and we dabble in these peptides, and for instance, people, tirzepatide, semaglutide, those are peptides designed for diabetics and weight loss now. But there are so many other peptides out there that have effects on our system and can do so many more things. And so I'm just fascinated by that. And I think it fits really well in because peptides don't really work great unless the system is starting to, sort of recover and get better. So it really works really well, in our practice to sort of level it up a notch. And people that have been chronically ill for a really long time, like you can't just magically, change the diet and pop a couple supplements and expect improvement there. So for me, what I drive is the patients that are more challenging for me. With mitochondrial dysfunction or chronic infections, and where peptides can play a role in that, and just additional testing. I mean, looking at things like I just heard about this test called Aurea. That's like a tear test where you can stick this little paper in your eyeball basically to collect your tears, and it has a marker for breast cancer screening. So there's so much out there that we can learn from a testing perspective of things that we can do from a preventative standpoint, or looking at, oxidative stress levels, which is basically what drives DNA damage for cancer, and that's not just breast cancer, but any cancer. Here we are trying to do the best we can to help people live their best life. And there's still that fear, am I going to get cancer? Is somebody going to get cancer? And so we're seeing more and more, sort of screening tools out there. At A4M, we heard about a treatment, fascinating treatment for Alzheimer's and dementia. So, I love seeing stuff like that, where it's like this connecting the dots type thing that can help us go to the next level for sure. All the genetic stuff that's out there. I mean, there's so much more for me to learn. I've been doing it for years, but
it's a continual learning.
Absolutely. It's fantastic.
Love it. And if there's one message that you want listeners to take away about functional and integrative medicine, what would it be?
Yeah. I mean, I said it earlier, and I think it's worth repeating, is just you owe it to those you love to be at the best place that you can be, so you can help them be at their best place. And I think that, if we're talking to somebody who's dabbling in this or listening to it as a provider, I didn't really see results until I started taking care of me. And it's really easy for us. I'm a mom, I'm a business owner, I'm a medical doctor, I'm a speaker, author, all these things. And I can be all those things, but I can't do it well if I'm not, taking care of myself. So it's really hard to do that in this world that we're in, and in the profession that we're in. We give all our all to everybody else, moms especially, and doctors especially. we sacrifice ourselves for everyone else, and your life is not going to change until you take care of you. So become the patient first. And most doctors in this world of functional integrative medicine, I mean, most people have their own story of when they got sick and they had to seek help, and they found functional medicine that way, and that changed their life for everybody else.
Yeah,
So
that's my girlfriend, the functional gynecologist. That was how
yeah,
she found it. Yep.
so don't wait till you get sick, find it
Right.
and start looking at some of that stuff for adrenals and hormones and all the things, and your gut, and you'll feel amazing. And then you'll be a much better provider and a much better mom, parent, whatever it is to your family and your loved ones too. So
It's a great way to test it out if you're still thinking it's woohoo. And then what is the best way to reach you, Doc? If doctors want to reach out or patients need to find you, what is your website?
Carolina Integrative Medicine.com is my office website, or you can go to Aimee Duffy MD is my personal website for speaking or business coaching type stuff.
Okay.
I'm on all the socials, so you can find me on
Instagram.
Facebook, Instagram, LinkedIn, all the places. You can send me an instant message. I try not to be on it all the time, but
No, of
probably
course.
at least once a day or so, I'll be checking those things. So
And is it best for physicians to reach you like on LinkedIn or Instagram? What's your preferred
yeah, LinkedIn. I'm
platform?
old, so Facebook.
Yeah, me too.
Probably Facebook
Me
more
too.
often.
I'm Facebook too.
Um,
So perfect. All right.
But
Well, I'll
either
have
way,
to
I'll get a red dot on my phone somewhere. So
yes, yes,
whatever
yes. Well, I'll
works
have
for
to
you.
connect with you there.
Yep,
And thank you so much for taking the time out of your busy practice to meet with us. And we really appreciate you being here. Thank you.
absolutely. Thanks.